Good morning, everyone. At the outset, I would like to thank ANSIPS for giving us the opportunity to present this topic. I would also like to thank my co-speakers, Ravi and Dinakaran, for setting a context for my presentation. And I would like to try to set some context for the next presentation by Shivshankar. So, the question that I am trying to answer is: does climate change increases the prevalence of mental illness? As you have already seen from presentations of Ravi and Dinakaran, that the climate change actually sets a process to increase the prevalence of mental illness. So, what does the research suggest? So, there has been significant increase in frequency of weather-related disasters. But the issue here is that how do you quantify? Is it very easy to quantify that okay, this increase in mental illness is because of climate change or because of other process? So most research has actually told us that it is very difficult. So there has been very much many number of challenges, like there can be inflation of the numbers, which, for example, if the person is feeling stressful, so there is a risk of you overdiagnosing it, or on the other hand there is also a risk of underestimating the mental illness. Further, most studies have used scales like GAD2. So, applying a scale like GAD2 in a natural disaster might actually tell you that there are anxiety symptoms, but that cannot always indicate that okay, there is an increased risk of mental illness. So, the kind of screening tools that has been used, pre-existing mental illness. So, if in a population which is vulnerable to develop these kind of disasters or this kind of climate change, and these vulnerable populations already have a pre-existing mental illness, that can also increase the risk of mental illness secondary to the climate change. Further, there are difficulties in temporal and spatial trends. Temporal, I mean to say that in terms of duration of exposure, if there is a disaster, so the disaster can cause problems acutely, it can also cause chronically. And uh, if there is a climate change like increased temperature by 1 degree, so how long do you take to actually assess this change in the climate on mental illness? Spatial trends, for example, a person is staying 30 kilometers away from the disastrous area to 60 kilometers away, so how do you quantify it? Which area do you take? So these are certain challenges that generally people or the researchers face when they wanted to study the incidence of or prevalence of mental illness during the related to this climate change. Having said that, there has been significant amount of research that has published looking at these factors. As you all know, that rising temperature and heat waves, floods and increased sea levels, drought, loss of forest, reduced air quality, and other disasters. So these can lead to either acute effects and cause mental illness, which are acute in nature, like for example adjustment disorder, PTSD, and these can have some certain amount of subacute effects, that these may not be cause acute illness, but these can increase the risk to develop long-standing effects. So there can be long-standing effects, for example, change in the temperature. So change in temperature can lead to variety of psychiatric increase in psychiatric illness, which we will be seeing. And secondly, these effects are more predominant in vulnerable population like elderly, low socioeconomic status, unemployed, past mental illness, women, and also dependent on certain factors like as I already mentioned about the temporal and special trends. Okay, so does then coming in specific with the research that has been published on different psychiatric illness, in so heat waves or increased temperatures. So heat waves or increased temperature can increase the risk of violence, aggression, and fatigue. And it has been noted that there is an increase in risk of IDD, intellectual developmental disability, and neurodevelopmental disorders, specifically when pregnant women are exposed to these heat waves and associated consequences. The neurodevelopmental disorders can be like ADHD, autism, etc. Also, there has been increase in rate of admissions with mental illness schizophrenia, mood disorder, and neurotic disorders. People with mental illness are three times increased risk of death due to heat waves. So this has been the studies that have been published on heat waves and increase in prevalence of mental illness. Further, disasters like tsunami, Hurricane Katrina, and Hurricane Sandy, bushfires, some of them are related to global warming. Also indicate, also there has been some amount of research that has been published how these increases the prevalence of mental illness both acutely in terms of and also in long. For example, these acute disasters can has been shown to increase the risk of post-traumatic stress disorder. This is one of the most important disease that has been studied at in during various disasters, and definitely it seems to be that there is an increased risk of PTSD, especially in vulnerable population following the any disastrous event. Also, there has been increased risk of adjustment disorder, complicated grief, major depressive disorder, and as you all know, ATPD, acute transient psychotic disorders. So there has been instances of increase of ATPD during these disastrous events. Also, in people who have already diagnosed with psychiatric disorders, there is a relapse of psychotic disorders. Further, among the population, among the survivors, there is a increased risk of survivor guilt. Suicidal ideation has been increased, and most commonly, substance use disorder and sleep disorders. These are two important conditions that has kind of increased during these disasters. Further, the research during tsunami, which has happened during 2004, and the amount of data that has been published shows that there is a in acute phase 20 to 40% has actually shown increase in mild psychological distress, whereas 30 to 50% has shown moderate to severe psychological distress, and also there has been reports of increased alcohol and drug use, uh, specifically from Indonesia. Further, the Katrina that has happened during around 2007, if I am not wrong, uh, people have shown PTSD 14.6% in first 6 months, and the numbers have actually gone up to 20% in 1 year. And the mental health services that has been provided has registered many people who had these problems, and till date there is a continuation of helping these people with for their mental health. And it is not just that acutely, but these have a long standing effects even after 2.5 to 5 years. The research has shown that there is a significant amount of increase in anxiety and anxiety attacks whenever it rains post this kind of events. Further, coming to bushfires, these, although it's not very common in India, but common in most part of the India. Yet, yes, there is certain places in India it's common. There has been a lot of research that has been published on Australian bushfires. If you have listened recently, there are Californian bushfires and Greek wildfires, and there has been associated research which shows that the mental health issues like major depressive disorder (PTSD) has increased, and also substance use also has increased. Another important thing that you should be knowing is drought. It is mediated through so many processes, as Ravi has pointed out, and long-term drought through various processes. It may be economic, maybe social, maybe particularly in vulnerable population like elderly, and it has been shown to increase suicide, both not only from developed countries but also developing countries like India. It also has shown that there is an increased risk of uh, depression secondary to this drought. A small point to add, which Dr. Ravi has also mentioned, and there has been amount of research on environmental green area. So, because of deforestation and loss of greenery, uh, so children who have been brought up in less green environment are shown to have higher risk of schizophrenia and higher risk of depression. Similar studies have been done by some of our colleagues in advance. with respect to Bangalore population. So lesser amount of greenery has been associated with higher risk of developing depression and schizophrenia if they have been exposed during childhood. So, if I have to summarize, yes, there has been alarming effects of climate change on mental health. As we have seen that anecdotal evidences that I have shown that there is an increased risk of mental health issues following the climate change. Specifically, more research has been focused on disasters because it is easy to quantify. Otherwise, the long-term effects of climate change on mental health, as we have seen, the amount of research is not uh, very much more. So we need more systematic research in this area. So I would like to thank, and I am very much happy to take questions at the end. Thank you.